Here we go. Okay, Terry, can you get our program started?
Sure. I'm Terry Stumpf, and I'm on the Program Planning Committee. Yep. And I'm going to pick up on Susan's information and make a challenge. 150,000 shots in 100 days. How about Girl Scout cookies for our next drop-in, which is in April the...
It's about COVID and what to do after the shots.
April...
Live your life.
14th.
14th. Everyone will munch on our Girl Scout cookies. How about that? Anyway, so the COVID-19 vaccine is here. Now what? COVID-19 is changing how we live here in Hyde Park, Chicago, across the nation, and around the globe. There are now COVID-19 vaccines available in multiple sites to get your shot in the arm. This session will focus on what you want to know about the vaccines, their efficacy and safety. More importantly, once vaccinated, what can we do after our shots? Our presenters today come to us from UChicago Medicine. Dr. Ross McMillan is a third year, as well as Julia Nath, both MDs, third year fellows in internal medicine. And Parata Patel, MD as well, is a sixth year fellow in gastroenterology. As you just previously heard, our drop-in is being recorded. The caption function is enabled. The session will have lots of information and useful. So listen, take note. Also know you'll be able to listen to it again later. During the discussion of the time, we'll all be muted except for the speakers. Keep your questions or concerns in a general sense. Our speakers are not able to serve as your personal consultants. Place your questions, concerns in the chat box. The speakers will track and address what you've put in the chat box as it's relevant to a particular topic at hand, or leave that for a Q&A session at the end of our presentation. Our discussion today is brought to us by Chicago Hyde Park Village, UChicago Medicine, and the Share Network. So enjoy. And to our presenters, thank you for being here and joining with us.
Awesome. Thank you for having us. My name is Ross McMillan. As Mr. Stumpf said, I am a third year resident in internal medicine. And this is one of my favorite activities, to be able to talk to people just in the community about healthcare. And particularly over the past few months, I've been doing a few of these just about our COVID vaccine, because I think it's an exciting time for us. We've lived through a global pandemic that none of us have ever seen before, but there is now light at the end of the tunnel for us to be able to get back to our lives as we had them once before. So with that said, we're gonna lead you all through a brief PowerPoint. At any time, as was also said, please feel free to put any information in the chat, and we'll try to monitor that as we go and provide more information from those questions. All righty. So this is a slide, or a slideshow rather, created by Dr. Dorian Miller, who is one of the attending physicians at the University of Chicago and is the director for the Center of Community Health and Vitality. Her role also as one of our advisors for our particular community outreach program is one in which she has great institutional wealth about Chicago, especially the South Side of Chicago, and also about the healthcare needs of our unique community. So we have a vaccine, and a number of people are very excited to get this vaccine. However, there's still some hesitancy, and a lot of that hesitancy breaks down into racial and ethnic lines as well. And so one of the things that we would like to do is just to make sure that everybody across race, ethnicity, gender feel as though they are well informed about what this vaccine means and how it can be beneficial to their lives.
Dr. McMillan, can you make
Sure.
your PowerPoint full screen?
Oh, I'm sorry.
Are those swap displays?
Yep. Sorry
Yep.
about that. My apologies. All right. And so part of this vaccine hesitancy is the fact that it was developed really quickly. And so we'll try to address that. Also, who was the vaccine tested on? How much does it cost? Will it make me sick? Will it change my DNA? And a quick answer to some of these questions, but we'll come back to this slide a little bit later, probably as we end, is that yes, it was developed quickly, but that does not mean that corners were cut. It was developed and tested on a number of different people from all ages, races, ethnicities, genders. How much does it cost? It's free to the public. So any American citizen, as long as you are currently in a group that is able to get the vaccine, does not have to pay. Will it make me sick? This is the question that I think is toughest for people, because the answer to that is it can make you, you can have some side effects, which we'll discuss in just a bit, for a few days. But overall, it does not make you sick going forward. And then will it change my DNA? And the answer to that is no, it won't. And so I'm sorry for the busy slide, but we'll go through this pretty stepwise. So right now, there are 2 vaccines that are currently available for people in the United States. Those are vaccines that were developed by, correction. As of this slide being made, there were 2. Now there are 3. So there's a vaccine by Pfizer and Moderna. Those are our mRNA vaccines. And there's also a vaccine created by Johnson & Johnson, which is our adenovirus vaccine. These vaccines, including the Pfizer and Moderna, have very high effective rates for preventing COVID-19 disease. So COVID-19 is the disease from which SARS-CoV-2, which is the virus, comes. SARS-CoV-2 is the virus, and then COVID-19 is that disease process that comes from that virus. It's kind of akin to HIV versus AIDS, where HIV is the actual virus, whereas AIDS is the disease process. And in that same manner, these vaccines protect us not necessarily against contracting the virus, although we're starting to see evidence that it does, but more so in contracting the disease process, the fevers and shortness of breath and clots in our bodies, lungs, brains. It can protect us against the severe effects of that. So both of the vaccines that are available, the Pfizer and Moderna vaccines are mRNA vaccines, which means that they have in them a recipe for one of the proteins that is on the virus. And so you're not getting the actual virus when you get this vaccine, but rather you are getting a recipe to create one of the proteins within the virus. That protein is necessary for that virus to be able to invade our bodies. And so what our bodies learn is that we can recognize this protein that's on the virus without ever having to have been contracted, without ever having to have contracted the virus. And thus, after that vaccination, once your body sees that virus out in the open, then our immune systems will kick in and thus recognize that virus and be able to fight against it. So as I said, they are not actually the virus. You are not getting the virus. Rather, you are getting just a recipe to create one of the proteins on the outside of the virus. And thus, this vaccine is not giving COVID-19. They have been proven to be very, very safe in a wide range of individuals. And as I mentioned, there is no cost to anyone who's going to get the virus in the United States. So I did mention rather, what mRNA vaccines are, but just again, very quickly. So the mRNA is a recipe or genetic material that will encode where my arrow is, this protein, this spike protein. And so it helps our body to create a certain amount of that spike protein. And then that spike protein that's in our body, it's not the virus. It does not function like the virus at all, but it helps our body to recognize when that virus does come into our bodies. And so this mRNA does not affect our own DNA. It does not go into our DNA. It is not in, and in actuality, the mRNA there, once it comes into our body, after a few minutes is destroyed. And so there is no longer any evidence. It does not stay in our cells. It does not stay around. And thus there are no long-term remnants of getting this mRNA. These types of mRNA vaccines, they're one of the reasons that we have been able to create this vaccines really quickly. So they've been developed for things like Zika and Ebola and SARS and can be done very, very quickly. We just have not seen it on this type of global scale before. We've had the capacity to potentially do it, but we just have not seen that in the past. And I know that there is one conspiracy theory out there that it can potentially track your location or be used by the government in order to just hone in on you. And that is just that, a conspiracy theory. And so the last slide that I will talk about before I pass this over to Parita is just about how we know that COVID-19 vaccines are safe. So the FDA approval process is very stringent and very strict. And so just because this happened quickly does not mean, again, that corners were cut. So the FDA is going to carefully and fully review data from all of the clinical trials, from all of the vaccines. And I think it's important to note that if they don't see something that they think is appropriate, then they will not approve a vaccine for emergency use. Case in point, I don't know if any of you all have been following over the past few days, but we have the Pfizer, Moderna, and Johnson & Johnson vaccines that have been approved here in the States, but the AstraZeneca vaccine has not been. They submitted some of their information to the FDA, but because the information was not presented in a manner that the FDA thought it was robust enough, they have to go back to the drawing board, and they are not on the trajectory to be approved anytime soon. And so there are multiple committees, including the Advisory Committee on Immunization Practices, that reviews all of the safety data for all of the vaccines, all of the patients, any side effects, especially severe rare side effects that have been seen. They are reviewed, identified, and noted. So with that said, I'm going to pass this over to Dr. Patel.
Thanks so much, Ross. Let me share my screen.
Oh, I'm sorry. Mr. Stump, I see. What about Bill Gates' chip in the vaccines? Well, that's a caveat, yeah. I forgot to mention that one. He did create, no, I'm just joking.
let's see. Let's go then. All right. Can you guys see that?
We can see it, Karita, but it's not in full screen.
Let's see. All right. Okay, so like Ross was talking about, the safety of the COVID-19 vaccine has been a top priority, and there's often concern about how quickly the COVID-19 vaccine was approved. And so the important thing to really remember here is that the standard has been held the same between the COVID-19 vaccine as well as all other vaccines. The only difference is that it went through something called an emergency use authorization, or an EUA. And this is usually done when there's a public health emergency like the COVID-19 pandemic, when we need to find a solution to help those who are suffering from the disease. And so the process is that a manufacturing company comes to the FDA with some data on their clinical trial. And at this point, they've had data on different phases of their trial involving hundreds to thousands of patients. And they present that data to the FDA, and they review both the safety and the efficacy data before recommending use. The difference comes in as to when the manufacturing of the vaccine actually occurs. So in normal circumstances, the FDA kind of goes through the same review process, but then they have to wait for a license to start manufacturing. When a manufacturing company has gotten an EUA, manufacturing can actually happen much sooner, and they don't necessarily have to wait for a license. But the review of the safety standards still remains the same. And there's multiple committees that kind of oversee this, like Ross mentioned. In terms of safety monitoring, so not only did the FDA kind of look at all of the safety and efficacy data while some of these clinical trials were going on, but they continue to do so as millions of people across the United States are getting this vaccine. And so there's multiple different safety monitoring systems. One of the newer systems is called vSafe, which can be found on the CDC website. And once you get your vaccine, there'll be information on how to enroll in this. But again, you can also go to the CDC website and you import some of your information as and when you got your first dose of the vaccine. And there'll be a series of kind of text messages to initiate a survey based off of how you're feeling. And then depending on what you report, you may even get a follow-up call from the CDC to ensure that you're doing well. The other thing that's important to remember is, as the vaccines are being administered to millions of people, the sites that are administering the vaccines are mandated to report any adverse events, so that that information is known to the CDC and can be tracked by the CDC. In terms of comparing the vaccines, so you can see both Pfizer and Moderna had thousands of people participating in the trials. Pfizer vaccine was found to be 95% efficacious, and this was similar in the Moderna vaccine. And they looked at people from all different groups, including different ages, different gender and racial and ethnic backgrounds. The Pfizer, both of these vaccines have 2 doses. For Pfizer, the second one is recommended 21 days after the first, and for Moderna, recommended 28 days after the first. And both vaccines need to be stored in cold temperatures. Now that we have the Johnson & Johnson vaccine approved, just to speak on that briefly, that also looked at a large population, I think over 40,000, and that is only 1 dose. And in terms of storage, it doesn't have to be stored in a freezer. I think the regular refrigerator is adequate for storage for that vaccine. this slide goes over just how involved the clinical trial process is. So before a vaccine can be approved by the FDA, there's different phases of clinical trials that they need to go through. In general, the group of patients that are studied, there will be a vaccine group and a placebo group. Placebo simply means not medication, but the participants don't know which group they're in. They'll be closely monitored after they get their vaccines. And then any symptomatic cases are diagnosed by the investigators. And they look at how many people in the vaccine group had symptomatic COVID, compare that to how many people were diagnosed with COVID in the placebo group. They'll also be tracking different side effects or adverse effects. And this clinical trial process goes through 3 phases. The first phase generally involves only a handful of healthy people. If those groups of people do well, then that clinical trial will progress to phase 2, which includes hundreds of patients. And then if that goes well, it will progress to phase 3, which involves thousands of patients. And when these vaccine manufacturing companies ask the FDA for emergency use authorization, they generally have data from all 3 phases of the clinical trial process. Another question that comes up is, have these vaccines been tested in a large group of diverse people? And the answer is yes. All 3 of the vaccines have been tested in a really diverse group of people with different backgrounds and different ages as well. Different medical conditions were also included in these clinical trials, and there was really no significant safety concerns between any of these groups. So I think it's really important to understand that who you are, what medical conditions you have, what background you're from, it is generally a very safe vaccine for you to receive. And then this is just kind of giving a little bit of more information about the different groups of people that were included in the initial trials in Pfizer and Moderna. So you can see over 30,000 were enrolled in both. They included over 30 US states and had people from a diverse racial and ethnic background. And then there were also people from all different age groups that were included. So now I'll pass over the presentation to Julia, who will continue to kind of talk about the differences with the vaccines.
Great, thanks, Parita. Let me share my screen here. And then, yeah, I know there's a lot of questions about what to do after the vaccine. Looking around, it sounds like potentially a lot of you have already gotten your vaccine, which is great. So I want to make sure to leave time for that. I think Parita already talked a bit about this, but this Johnson & Johnson vaccine trial, this is just because it's newer and coming out. I think it's important to just keep in mind that it was also very well studied. And while it's slightly less efficacious than the Pfizer and Moderna vaccines at preventing any COVID-19 infection, it is 100% effective in preventing what we really care about from COVID-19, which is hospitalizations and death. So it's still a really great vaccine. It's a one-shot series as opposed to 2. So it's sometimes easier and it's easier to distribute. And we definitely encourage people to get this vaccine now that it's available. So before and after getting the vaccine, beforehand, be patient and persistent, I think is the key point there. I know as this has been rolling out and I've been talking to my friends and family, like my mom is 64 and has been waiting forever to get this vaccine, and she's being patient and persistent and just waiting to see when she's going to be able to get it. And you can do the same thing. Public health guidance comes out from the city of Chicago, which is technically its own vaccine area. So it's slightly different than the state of Illinois, to keep in mind. So if you hear guidance about the state of Illinois eligibility, it might not apply to the city of Chicago because we get a separate lot of vaccines and make separate rules about eligibility. And you can find out where to get it on the city websites. And there are also vaccine distribution through healthcare providers, including the University of Chicago. So if you're a patient with us, you will be getting information about that. And then afterwards, just to make sure that you're getting the second dose, if you're getting the Pfizer or Moderna, which is a 2-dose vaccine. If you're Johnson & Johnson, it's 1 and done, which is wonderful. Prepare for the side effects, which we can talk about a little bit more, maybe mainly the sort of flu-like symptoms are the most common afterwards, the fevers, headaches, and muscle aches, for which you can take Tylenol or ibuprofen if you're allowed to take ibuprofen with your health conditions. And you should also obviously follow the public health guidelines. The side effects, as we talked about, are important to keep in mind. I see there are a bunch of questions coming in, so I'll make sure to leave time for that. Oops. The biggest ones to keep in mind are that flu-like symptoms and arm pain. Those are the common ones. The flu-like symptoms tend to occur in the 2-dose series more commonly after the second dose, although they can happen after the first. They tend to be very self-limited, no more than 24 to 48 hours. And again, you can take Tylenol or ibuprofen after you get those symptoms. And then sore arms also tend to go away. You can also get some redness around the site of the injection, and that can be normal. There are rare allergic reactions typically that occur with very shortly after an injection, which is why if you guys have gotten the vaccine, they make you stick around for like 15 to 30 minutes afterwards. It is extremely rare. It's like less than 1 in a million people, less than 10 in a million people. And it tends to be people who have had anaphylactic reactions to other vaccines or ingredients, which they screen you for in advance of the vaccine. Serious and adverse events, I think the biggest takeaway from this vaccination effort is that, we have not actually had terrible, like serious adverse events that we found are more common in vaccinated people versus not, which is fantastic and actually a big testament to how well tolerated these vaccines are in general. And then after, the other thing to keep in mind is besides vaccination, we can all keep doing the good public health things, which I will talk more about. I think this was a question that everyone wanted to get more about, and I just pulled this from the CDC website. In terms of after you get vaccinated, sort of how do things change for you? In general, and I can say this as someone who's been vaccinated, it should allow you to take more social opportunities to get together with vaccinated people. I think it's important for people's mental health to have those social connections. And given the low rates of transmissibility that have been found for people who are vaccinated and the high effectiveness in preventing COVID-19, although not 100%, the CDC is saying it is safe for vaccinated people to gather together. It is also, in theory, safe for the vaccinated people to get together with low risk unvaccinated people. I think the thought there is that the vaccinated people are unlikely to spread it to the low risk people, and the low risk people, even if they happen to have asymptomatic COVID-19, the vaccinated people are relatively protected. That said, I would say, take that with your own grain of salt, depending on your own health conditions and your own level of risk taking if you are the vaccinated person, because these vaccines are very effective against severe disease, but they are not 100% effective against COVID. You can still get COVID after getting the vaccine. 95% is not 100. So if you are someone who really is trying very hard to prevent COVID, this is not saying that you should get together with unvaccinated people. It's just saying you can if that's within your choice range. If, however, you are vaccinated, it does not mean that you should get together with high risk unvaccinated people, because while again, this is very generally effective, it's not 100% effective, and you can still get COVID, be asymptomatic, and give it to someone in theory. And we would hate for someone to get hurt by that. And the CDC recommends against it. The best way to minimize those risks are to take those same prevention measures that we've been taking before the vaccines came into play, which is wearing a mask, staying outdoors. Outdoor transmission is, I think I read, less than like 20% lower than indoor transmission. So well-ventilated areas, especially as the weather gets better, is important. And then distance is still very important, staying 6 feet apart, and good hand hygiene. So in those cases where you're getting together with unvaccinated high-risk people, all of those same things still stay in place. None of those guidance items have changed. So that's the biggest thing. In terms of who is getting the vaccine, we are sort of moving, I think the arrow's a little out of date. We're moving a little bit through 1B, tentatively towards 1C. I believe the 1C is starting for Chicago on the 29th. So we're getting to there, and hopefully we will get to phase 2 very soon, and we will have herd immunity so that life can really get back towards normal. I have a bunch of resources here. I'm happy to share the links of those to people at the end of this, because I know you guys probably can't click on these links directly, but definitely the city of Chicago is a great place to go. And then we at UChicago obviously post updates as well. And if you're a patient with us, you can definitely check our website. And if you're not, definitely reach out to your doctors and your hospitals where you get care. And then the CDC, where I just pulled that recent infographic from, they are a great source of updated public health recommendations and do keep their website very up to date. So I'm going to take a look at these multiple questions in the chat. But it looks like everyone's answering them.
Yeah, Dr. Patel and I have been trying to answer them, but I do recognize that this is a recording. So we'll just back up to some of the questions and just answer them in a more pointed manner. So the first question was about just a dinner gathering amongst vaccinated individuals. And Dr. Nath was able to answer that with her previous slide, which is if all 4 people are vaccinated, or 2 people are vaccinated and the other 2 people are low risk, or at least a household rather, then there are no prevention methods that need to occur. However, if there are higher risk people or there are multiple households, then we do need to continue to take the same precautions that we had previously done. Wearing a mask, hand hygiene, 6 feet apart, etc. And then I'll kick it over to Dr. Patel in a bit after answering Susan's question, which was, what's the latest safety data for the vaccination in pregnant women and their fetuses? She was saying that it's obviously not a question for this group, but many people have nieces and children and family members. I did not know that you all were any less than 35, so you fooled me. But I will say that currently the vaccine is noted to be safe in women that are pregnant. And actually, there also is more data that suggests that immunization is passed from the mother to the fetus after the mother has been vaccinated. But I think the CDC's recommendation is also for any pregnant women or women that are attempting to get pregnant, if you have any questions, then please discuss with your obstetrician or gynecologist prior to taking the vaccine, especially if you have questions.
And the one thing I'll add to that too is there was a lot of concern or myths that the COVID vaccine could cause infertility, and that has not been proven to be the case. So if that was something that someone's heard, be rest assured the COVID vaccine does not cause infertility. Let's see, another question was, how do we reconcile the fact that people who've gotten both doses of the vaccine still test positive for the virus? The first thing I'll say is that the vaccine doesn't necessarily provide protection from contracting the disease. You can still contract SARS-CoV-2, but what the vaccine will prevent you or will protect you from is getting severely ill. We know that it has decreased the rate of death and decreased the risk of severe illness. And so that's why we still recommend getting the vaccine. Most people that I've heard of that have gotten the virus after getting the vaccine, it's very mild symptoms, kind of like a cold or a flu. They don't end up in the hospital as frequently, and they certainly are not dying from the virus as we were previously seeing. And then there was a question kind of about how do we form trust again in some of the political organizations. I think Dr. McMillan answered that really well. I know that it can be a really frustrating environment when there is kind of different information from the political community, the scientific community. I think your physician is always going to be the best source of information and should be your best advocate when you have questions like this. But certainly, we are kind of starting to see a change in both the political community aligning with the scientific community. And then let's see. And then there was a question about providing proof of vaccination prior to travel. I actually did. I didn't know kind of the up-to-date info on that, but I just pulled up the CDC website that does mention showing proof of a negative test prior to international travel, but no such thing is in place in terms of domestic travel. Overall, the CDC still recommends avoiding travel if possible.
And just on that front, if you are planning to travel, there are testing sites at Midway and O'Hare that can be used to provide those proof of negative testing prior to travel. And then there was a question about immunity and how long it lasts. And Dr. McMillan helpfully answered that as far as we know, it lasts at least 90 days, potentially longer. I think the relevant thing from there is that we do recommend that people who have had COVID do get the vaccine because we think that the immunity from the vaccine lasts longer and is stronger than the immunity from having COVID itself. We do, however, recommend that they wait 90 days after having COVID to get the vaccine because of the persistent immunity that they already have and making sure that there's available vaccine for others, et cetera. And there was a question that came in just now about immunosuppression, and that's a great question. I would say if you have specific questions about immunosuppression in your unique situation, definitely speak to your physician because they know you well and will be able to comment on your unique immunosuppressive needs. As a global rule, the CDC does not say that immunosuppression is a contraindication to getting the COVID vaccine. There is potentially some evidence that it doesn't create as robust of an immune response in immunosuppressed people, but I don't know the specific data on that. And they still, in general, recommend it, and it has been studied in immunosuppressed people in the studies, and it is safe. So I think in general, you can get it, but I would refer to your specific physician with questions. And then there's a question about modifications of COVID-19. We're talking about the variants here, correct, Ellie? Yeah, okay. So yeah, that is a great question. and it's changing every day. So I apologize if I don't have the most up-to-date information about all of the different variants. As far as I'm aware, I know of studies on the UK variant of the COVID strain, and that the vaccines we have, mainly the Pfizer and Moderna, are still effective against that strain. Beyond that, I am not 100% sure. Ross or Preeta, do you know anything else?
I think there were some studies about the South African variant, but with the AstraZeneca vaccine, and that it was less effective. But I think that for the Pfizer and Moderna, I don't think that there was any difference. And then the second part, or second and third parts of that question, how much are they at risk in Chicago? I think that variants in general are probably going to be more pronounced in larger cities, just because there's more mixing, more traveling. But since we're seeing that there is no difference in how people are contracting and people are being exposed to severe disease with those variants versus the original SARS-CoV-2 virus, then I would say once vaccinated, the likelihood of any differences are going to be much less. And then there are currently, I think, boosters and other vaccines that are being developed in the event that some of these variants do become more worrisome. And I think one thing that we should probably wrap our heads around is, like the flu shot, having some sort of booster shot every year, every other year, for some period of time.
And there are a couple other questions that just came in. And then one from Terrell about a Walgreens requiring information for, is this for a vaccine? Is that what you're getting at?
Yes.
So in
Interesting.
general, I mean, from what I've heard, when COVID vaccine providers can't charge you for the vaccine, they're not going to ask you to do any co-pays, and they can't deny vaccination to anyone who doesn't have health insurance coverage, is underinsured, or is out of network, to my understanding. I don't think that that's changed. And I think if anyone's running into that issue, speaking to their physician and seeing if they can find another avenue to get the vaccine would be appropriate. But at least from what I've heard, that should not be a reason to be denied a vaccine at all.
Yeah, and then the next question is about potential future surges and changes to recommendations for the vaccinated. That is a great point and absolutely true. All of these public health recommendations are subject to change if the global pandemic situation changes. And that's why it's important to check those verifiable sources for up-to-date information, whether that's your physician, whether that's the CDC website, or whether that's the City of Chicago websites. The resources we had at the end of the PowerPoint are my general go-tos. I think the City of Chicago provides pretty good up-to-date information. The CDC, especially nowadays, is pretty up-to-date. And then obviously your physician is your go-to for your individualized recommendations. And this very well could change. And I would also stress that, you know, COVID is definitely still out there. So when you are going out in public, and I don't know if I've made a big enough emphasis on that when I was talking, but when you're going out in public, we still recommend all of those same precautions as before, because you don't know who else is, say, in the grocery store or at the post office. So wearing your mask, washing your hands, and staying distant from other people, even if you've been vaccinated. The changes in recommendation are really for those small gatherings between people who are vaccinated and know that they're vaccinated and trust each other.
I think Susan's question about travel increasing and the efficacy of vaccines used in other countries is a good one as well. And so different vaccines have been approved in different countries. We've been talking about some of the different variants of the vaccines that are approved here, but ones that we haven't talked about are those in China and Russia, and they also have similar efficacies that have been studied. What I would say though is that I would trust the data, but also be just in general skeptical of travel. And so just making sure that you are doing everything that you can in order to stay safe, wearing your mask, staying distance as much as possible, washing your hands, doing all of those things. Because while we are confident in what has been the case, we don't know in different countries about different variants that may be there, and just in general about the safety and intermixing of different people. So just be cautiously optimistic when traveling. And then I don't know about, so Barbara's question is about undocumented people being eligible to get the vaccine.
Yeah, I just did a quick Google search because I wasn't sure either. And I saw some news articles saying that Biden states that undocumented immigrants should have access to the vaccine. I didn't see anything on the CDC website in particular, but to my understanding, and just to kind of go back to the question about if you're like if you don't have insurance, will you be covered? I think if you're going to like a pharmacy like Walgreens, Rite Aid, they may ask for your insurance information just so that they can maybe later bill the insurance company, but they can't turn you away if you don't have insurance or if you're undocumented, to my understanding. They may ask you for that information, but not having insurance or not having citizenship should not turn you away.
In theory, they shouldn't be billing your insurance, but we don't claim to know what happens at every pharmacy around Chicago, and it certainly could vary place to place. There's another question about travel, and I think, as Dr. McMillan was saying, it's very good to be skeptical of travel. I think it becomes a risk-benefit analysis for you. Again, the CDC guidance about gatherings between vaccinated people are for small household gatherings between people who know that they're vaccinated and stay together. However, that said, I mean, everyone is unique and it's a personal decision, but I know, people who are grandparents who have wanted to see their grandchildren forever, who have finally gotten vaccinated, and it does protect you personally against those really severe forms of COVID, but it's not 100% effective against all COVID. But they made the personal decision that they wanted to get on the plane, wear the mask, do all the precautions, and take as many precautions as they could, but knowing that it's not 100% safe, and still go to do it now that they've been vaccinated and know that the risk is so much lower than it was for them personally before they were vaccinated. But that is not official CDC guidance saying that's okay. Like that is, and as someone's doctor, it's all about the personal risk and benefits. So I would talk about that with your family, with your doctor, like if you're considering travel. It's not something the CDC says it's safe at this point, even for vaccinated people. These are all great questions, you guys.
Any other ones?
I'll ask a question if there aren't any others. I'm supposed to travel tomorrow to New York. And I looked at the requirements a couple weeks ago, and there was just a form where I had to get a green light saying it was okay. And I did that. But while you guys have been doing this presentation, I thought I better look again. And now it says I need a test. Mm-hmm. And I'm kind of panicking right now. So I don't know. I actually haven't, I did have my first vaccine 2 weeks ago, but I've never been tested. So I don't know a lot about testing options or what you recommend. I know they're available in lots of places.
Yeah, so I mean, what I will say is my mother-in-law just traveled. Her family's in India, and she really wanted to see her mother, and she's a physical therapist, so she had gotten vaccinated anyway. So she was doing travel. She flew from Texas to Chicago and then was going from Chicago to India. So for the domestic travel, they do ask for a test. If you can get it, that's wonderful. Again, as I mentioned, there are travel testing sites specifically at O'Hare and Midway. I believe you do have to make an appointment for that. However, she did mention that it is never verified. So they never actually asked her for the test. That is an anecdotal response to this, and I cannot guarantee that that will be this case for you when you travel. And I definitely would say that even if you've had one vaccine, it is always good to get tested, because you could be contracting it on the plane or like spreading it to another place. And if you're going to be seeing people, it's always good to try and make sure you're aware of your COVID status. And then the form you do need to fill out for international travel. There are more strict requirements where they actually like require you to upload the results, and like there's verification, and there's a lot of hoops to jump through. But again, anecdotal. Ross or Parita, I don't know if you have more firm recommendations on that.
I've traveled domestically. I went to go see my mom and grandmother, who are both vaccinated, in Florida, and I was not required to upload any sort of information or even answer any questions about if I had been vaccinated or not. It was more so, have you been exposed over the past few weeks to someone with COVID? And then do you have any of these other risk factors: fevers, chills, shortness of breath, runny nose, loss of taste or smell? And then similarly, my mother-in-law was also traveling to India, and was required to upload her information about testing and vaccination, but that is international travel as well. So domestically, I don't know exactly where you got the information from, if it was from the airline or if it was from whoever you would be seeing, but I think you would be okay without both having proof of the second vaccination as well as having proof of your test. But as Julia was saying, I think it's great whenever you have the ability to get tested.
Thank you.
I think this is a good question to end on. The Spanish flu was followed by the Roaring 20s. Can we look forward to such a fun period ahead of us? I hope so, Susan. I think that would be great. I would love that.
Susan seems like a partier. I love it.
Let's have a big party.
Love it. Sorry, there were just two others. Terry had one about Loretta and other organizations' abuse of privileges with vaccines in general. I think people should wait their turn. I think it's, there will be enough vaccines out there for everybody in the United States. President Biden has suggested that by May, everybody should be able to be vaccinated. So I will leave the political parts of that question out of my statement, but just saying that people should wait their turn. And then Mary was asking to comment on people traveling to see their family where neither the parents or the grandchildren have been vaccinated. And that is one of those things that, again, you yourself will be protected against at least contracting severe COVID, but you should at that time wear your mask, try to stay distant as much as possible to protect those children and grandchildren.
Any other last question? Well, this has been great. Lots of information, lots of our questions answered, gives us a lot to think about and consider as we go forward vaccinated. I want to thank Parita, Ross, and Julie for joining us today and leading our discussion. I also want to thank Dupi and Asha, both from UChicago, who helped facilitate arrangements and speakers for today. They've been helpful, and Jason at Share Network led me to Asha. So It's all a web of connections. Thank you. And thank you for each one of you being here. It was great. And don't forget the 1,150 vaccinations, 1,000 vaccinations in 100 days. But we have a new challenge. Cookie Scout cookies for our next drop-in in April. Everybody wave your box of cookies. Thank you one and all, and it's been great.
Thank you, everybody.
Have a great day.
Bye-bye.